My name is Becca Keats, and I'm going to be doing a presentation for Counseling Class 881 on how to apply behavioral and cognitive behavioral family therapy techniques to family life education. Although there are many different approaches and techniques within behavioral and cognitive behavioral family therapy, I'm going to choose to focus on 5 different approaches. The textbook that I reference throughout most of the presentation is called Family Therapy, History, Theory, and Practice, 6th edition by Samuel Gladding. Let's get started. The first approach from behavioral and cognitive behavioral family therapy that I would like to talk about is education. Although many people do not associate family therapy with education, both go hand in hand. Behavioral and cognitive behavioral family therapists use education as a tool to help families learn more about their relationships and the struggles that they go through as a family. As a family life educator and not a therapist, education is my main tool of interaction with families. I use education to help prevent and intervene in problems that families have. One can educate families by giving them lectures, presentations, assigning books for them to read together, or even having lively discussions about certain struggles or problems. These are just some of the ways that I like to educate families. Education is very powerful because it helps empower families to take charge of their own lives and deal with problems head on. Education is the main tool that I use and definitely an inspiration from behavioral and cognitive behavioral therapy. The next approach from behavioral and cognitive behavioral family therapy that I would like to talk about is their focus on communication and problem solving strategies. This is very similar to education because when you talk about communication and problem solving strategies with families, it usually involves some sort of education. Talking about communication and problem solving is always great for families, especially those with young children or those newly married couples. This also helps empower a family to take an active role in their life, as now the next time they have a problem communicating or need to solve a problem, they have different strategies and tools to use that they didn't have before. Communication and problem solving strategies could be used as a part of an educational seminar, such as one that is focused on building skills, or as it encompasses so many different things, communication and problem solving strategies could be its own seminar and probably the way that I would approach family life education for those families that were having problems communicating or solving problems. The next approach from behavioral and cognitive behavioral family therapy that I would like to talk about is called contingency contracting. Although this is a less recognizable name than education or communication strategies, contingency contracting is a very effective and helpful strategy for families to know. Contingency contracting is when two parties write down or chart a behavior in order to reinforce that certain positive behavior. A very common use of contingency contracting is parents making a chart of behaviors, such as chores, in order for a child to get an agreed upon reward or allowance. In other words, a parent might make a chart in which the child has to do all of the chores before receiving a reward, such as a treat or their allowance. Contingency contracting is sometimes called token charts, as each child has to earn tokens in order to get their reward at the end of the designated time. Contingency contracting is a great intervention tool for motivating children. This also helps give the child a visual reminder and a visual and positive reinforcement of correct behavior. I suggest using contingency contracting with families that are having a difficult time motivating their child to do positive behaviors such as chores. Contingency contracting is also a very helpful thing to use in education. In the elementary school that I work in right now, we use token charts or contingency contracts for the children to help them to complete their homework or desired positive behaviors. However, I do know many parents that have used this contingency contracting on a family level that have had great success as well. Another approach from behavioral and cognitive behavioral family therapy that applies to family life education is called charting. Charting is not to be confused with contingency contracts that are charts, as both are very different. Charting is a recording of a frequency of a certain behavior, usually an undesirable one. Charting is often used for recording undesirable behavior in children. Charting provides an awareness for all the parties that are involved. For example, an educator or therapist might ask a parent who's complaining about a child having tantrums daily to chart how many times a child has a tantrum in a day. This allows the educator and therapist and parents to be on the same page and also ensure that the parent is not exaggerating a certain behavior. Charting provides a baseline or a starting place so the family can recognize progress. In other words, if that parent charted that her toddler had a tantrum 3 times a day at the beginning of therapy or education, then a couple months later charted it again and realized that the toddler had only 2 tantrums per day, they can see that progress has been made, although the parent still might feel overwhelmed by the tantrums. Charting is a helpful way for the family and the educator or therapist to be in touch with reality and see what is truly going on when it comes to a certain behavior. Another helpful technique from cognitive behavioral and behavioral family therapy is found in modeling and role playing. Role playing can be defined as 2 parties acting out a scenario as if they were real life characters in a certain imaginary situation. For example, university students in their 20s might role play as a family with a spouse going through a midlife crisis in order to learn more about how the family is impacted by a spouse going through midlife crisis. Modeling and role playing adds dimension to learning and engages many different learning styles. In addition, it gives families a chance to troubleshoot different problems in an environment where there are little to no consequences. Modeling and role playing is especially great for parents who want to learn new parenting techniques. I would use modeling and role playing as an exercise to get parents to imagine different scenarios and how they should best react in any given situation. In addition, when an educator role plays or models a technique for the class, it allows the class to see how to use the technique in real scenarios. Overall, modeling and role playing brings learning to life. Here are some resources and books that I used in my presentation. If you'd like to know more about a subject that I covered in today's presentation, these references are a great place to start. In addition, if you'd like to know more about family life education, the National Council for Family Relations has a wonderful website, ncfr.org, and that's a great place to start. Thank you so much for listening.